Shield your home, see your home. The Sloman's Shield.
Welcome back to this CNBC special report. Day 18 of the Obamacare exchange rollout, and state and federal exchanges are still plagued with glitches. And today, the Wall Street Journal reports that insurers say they've been getting flawed data, even from the trickle of enrollees who have managed to get through and sign up. So, is this the tip of the iceberg? Let's bring in two health policy experts, Hadley Heath from the Independent Women's Forum, and Bob Goldberg, co-founder and vice president of the Center for Medicine in the Public Interest. Bob, let me just start with you. Do you think Obamacare has a chance to succeed?
I can only go by my experience. I tried enrolling after...
So did I.
I enrolled as Mickey Mouse.
Mm-hmm.
And the good news is...
Were you able to get coverage on those ears?
Well, see, the thing is, I have a prescription for cheese that they weren't going to fill, which is a whole other issue. But they kicked me back because I didn't give them a Social Security number, which I thought was kind of interesting. Like, how do they know that I was the Mickey Mouse? But here's my concern is this, is that as bad as the rollout's been, I've been dealing with cancer treatment issues, and it's horrible to figure out if you're going to have the doctor that you have, if you're going to be able to get the drugs that you can. You don't know what the co-pays are. So as bad as this rollout is, it's probably going to be worse when you're trying to get the care that you need under these health exchanges.
Hadley, in the beginning, the president compared the rollout of the exchanges to Apple's iOS 7, saying this wasn't perfect, but that's not to say that they're going to ditch the product. But I think consumers gave it about, let's call it roughly a month to fix that stuff. But what do you think is the time frame here before people just say enough with it already?
Well, that's an important question because people who are signing up now, at least according to insurance companies, maybe some of the sickest people, maybe some of the customers who have the patience and determination to try to sign up again and again and again because they're desperate for insurance coverage. Meanwhile, those young, healthy customers that insurance companies love may be more likely to give up in the beginning. So this is truly an embarrassment for the Obama administration, and more than that, it's an illustration of government's ineptitude to make millions of decisions that should be free and personal about individual health care.
I mean, I think you made a really good point, Bob, where you were saying there's quite a bit of a disconnect, isn't there, with what's going on here in terms of trying to get enrolled, and really only the most determined of people at this stage are going to get on, and yet all the things that we say, and even the president says about how America is like, you know, right at the cutting edge, right at the forefront in terms of medicine and treatments and procedures, and it's this incredible gulf there. Well,
let me give you an example, and Heather's right that the people that are going to sign up initially aren't the healthy invincibles. They're going to spend 30 seconds and go, forget it. You know, I can just go to the emergency room or take care of myself at the gym. It's people who really need the care. And there's a further disconnect, and that is that the drugs that are now available, the doctors are now available, those networks have been compressed, almost like taking a cotton shirt and throwing it in the dryer and coming out short. New medicines that are coming out in the market by every month will not be available on these plans for 2015. They're not, the plans are not required to add new medicines until the HHS board reviews it again in 2015. Well, there's a new drug for early treatment of breast cancer that was just approved. That's not going to be on many of these health plans formularies.
You know, Hadley, let me turn to a question that's sort of been on my mind and sort of stuck in my craw for a long time. And that is that I think we will have very little success in restraining medical cost growth until individuals really come face to face with the cost of their care. So long as there is a third party interposed between them and the care they receive, it's very easy for them to say, okay, well, that's some outside force that's doing that. But here, as I go on these exchanges and I look at how much unsubsidized insurance is going to cost, I am beginning to get a very clear view of how much this costs me. For a family of four earning, let's say, $60,000 a year, this is a huge nut.
Exactly. What you're talking about with having some cost sharing or some copays is what you might refer to now as catastrophic insurance coverage or what we might have referred to many years ago as real insurance, insurance that's there when you need it because of an unexpected emergency. But the Obamacare plans in many ways are the opposite of catastrophic coverage because they force you to have first dollar coverage of many of the basic, normal, preventative care things that we seek from our doctor, but then the deductibles are also very high. So they may be high deductible plans in some cases, but they aren't truly catastrophic or truly insurance plans. They're more of a way to redistribute costs within healthcare. That doesn't bring healthcare costs down. Subsidies are simply, you know, the Affordable Care Act's mechanism to try to reduce costs for some consumers. Meanwhile, their actual bill is being paid by someone else, and that's taxpayers.
Right. Hadley, Bob, stick around. We want to explore another angle of this now, which is the healthcare industry is going through a massive